Welcome back. We're here at Cardiovascular Experts in Camp Hill, and we're actually here in an operating room in the facility. Joining me right now is Dr. Raj Dave, President and CEO of Cardiovascular Experts, and a patient of his for us, Deep. We're going to talk to you a little bit later, but first, we did talk, Dr. Dave, about the increase of heart attacks during the holiday season. Why don't we talk about what are the symptoms of a heart attack?
So the most common symptom for men as well as women today for having a heart attack is chest pain and shortness of breath. Most of the time, almost 80% of the time, this chest pain feels like a chest pressure. It can radiate into the neck, it can radiate into the jaw or into the arms. And that should be the first warning sign. Especially in women, there are occasional atypical symptoms such as they could feel nausea, fatigue, tiredness, vomiting. Those are some of the atypical symptoms and presentations of the heart attack, but the most of the time, we want people to look for chest pain and shortness of breath.
Dr. Dave, that's great to know those symptoms. Now for us, why don't you share your story with us?
Sure. Actually, it happened this Saturday right before Christmas, a couple of days before Christmas, and I was responding to a stroke call in Lancaster General. I'm in medical devices, so I was on my way there to respond to a stroke. And I felt this just terrible pain in my chest. It was a penetrating pain from my chest to my back, radiated all down my arm. I just knew that there was something wrong. And as soon as I felt it, I called Dr. Dave, who was a great friend of mine, and I asked him what I should do. I also called my brother, who happens to be a cardiologist as well. And they both told me to go and get checked out, get an EKG. I actually did. I got an EKG and it turned normal. So I was a little bit of relief, but Dr. Dave insisted that I go to the ER and get a troponin level check. Once I did that, the troponin level came back positive, and he knew that I was having a heart attack. He came in right away and put me on a table much like this one, and I was able to put stents in my right coronary artery and save my life.
Wow, what an amazing experience. Dr. Dave, why don't you tell me what type of surgery did you perform on an operating table like this?
Yeah, so today the standard of care in the world when somebody is having a heart pain, or if you want to call it a heart attack, or there are many other medical terms for it, is to use a small plastic catheter that we use to go inside the heart artery, and then we run our equipment and put a stent in and open up the blocked artery and restore the blood flow. And that was the procedure which was done on Firas in a same exact room like this one. And that's where all these procedures gets done.
Yeah, that's truly a life-saving operation. What message do you want to send to our viewers?
Well, something that's very important is just listen to your body. When it happened to me, the first step was always denial, that I'm going to be okay, this can't be happening. I was only 42 at the time. But in my heart, I kind of knew that there was something wrong, so I followed through on that, and I'm really grateful to have done that. I'm able to be around for my family and for my boys, and it's very important to just listen to your body. When you feel that there's something wrong, follow through with it. We have this incredible medical equipment all around. We have incredible physicians like Dr. Dave. They're able to help you. They're able to extend your life so you can enjoy it. So listen to what your heart's trying to tell you, no pun intended.
That's certainly some great advice. Dr. Dave, how can our viewers get in touch with you?
They can go to our website. We have a dedicated page for heart problems, and they can learn more about it, or they can call our office for consultation or even a question, and we're happy to answer them. Our phone number is on the screen.
Thank you both for being with us.
Thank you.